Welcome to Living the Dream for General Practitioners, the podcast for doctors and clinic leaders who want to learn about pathways, strategies and opportunities for living and working in Australia. Join me, Gemma Goff, and my expert guests as we share stories and unlock the secrets to recruitment success. We share tips for moving across the world, navigating new cultures, and so much more. This show is brought to you by Recruitment Australia. Now sit back, relax, and enjoy this episode. Hello everyone, and welcome to Living the Australian Dream for General Practitioners podcast series. My name is Gemma Goff, and I am a co-founder and managing director of Health Recruitment Australia. Today, I'm delighted to be joined by Dr. Iain Nicolson for our latest episode in our Clinic Leaders series. Each week, I'll be meeting clinic leaders from across the country to give them an opportunity to showcase their clinics, highlight GP vacancies, and share with you why their practice is the business to join and why they choose to work with Health Recruitment Australia and the benefits this has brought them. So Dr. Iain Nicolson is the founding general practitioner of the Sale Medical Centre based in Victoria. Thanks for joining me today, Iain.
It's a pleasure.
So as usual, we'll just jump straight into the questions. Perhaps you could share with our listeners a little bit about yourself and who you represent, your position, how long you've been there, and anything else you'd like to share with us.
Well, I came out to Australia in 1977 at the request of the Victorian government to work in the country, and I have been there ever since. I have lived in Sale since 1985 and been operating the Sale Medical Centre as an entity since about 1995. And we are now in a purpose-built building. We have 2 branch surgeries which are connected electronically to the main centre. And I think we operate a very good service.
That's the main thing. So I assume you've noticed quite a few changes since you moved to Australia those years ago.
Well, yes, we started with paper cards, something like the old National Health Service in England, and now, of course, we're fully computerized. We send prescriptions direct to the chemist or to the patient's phone. We don't really have any paper notes. Any correspondence that comes in is preferably sent electronically, and it's immediately incorporated into the patient's file. We embrace the use of electronic means of communication, recording, and so forth.
Yes. Tell us a bit about Sale itself. Has that changed quite a bit since you've moved there?
Sale is an interesting town. It's different from many other country towns around this state in that it has multiple layers of employment, which shields it from various recessions that occur in industries. We have a large hospital, which is a major employer. We have 3 secondary schools and 5 primary schools, all within the city boundary. And we have a TAFE college. We have which has connections to a university as well. So education is a large employer. We have the offshore Bass Strait oil and gas industry, which, whilst is in a wind-down state at the moment, and nonetheless, there's probably about 25 years of work still to be done out there. Decommissioning, there's still some gas being produced. So that industry has its base at Longford, which is not far away from Sale, and they have a number of supporting firms. As a practice, we do a substantial amount of occupational medicine for the oil industry and various other industries, mining and so forth. So that provides us with jam on the bread and butter. And the town itself also has, surrounding the town, a very prosperous farming area, both dairy, grazing, and sheep and wool production. So it's a broad-based town. So it's not a town that's set on one particular industry.
Yes, and I believe there's an Air Force base near there as well.
Yes, we have the Central Flying School for the Royal Australian Air Force. So they're training their pilots there. They train navigators and all the other ancillary Air Force stuff.
That's quite amazing then for GPs that were looking to relocate to Sale. There sounds like there's lots of opportunity for family members to find employment within that the area as well.
Absolutely. Anyone who's got qualification as a psychologist or a nurse or a pharmacist will not go hungry.
Amazing. So quite a mixed demographic in Sale?
Yes, there is.
Yeah, so that's great for doctors wanting to make sure they get a real plethora of patients through the door.
Oh, yes.
That's excellent. So going back to the practice there, Iain, is it bulk bill, mixed billing? Tell us a bit more about the practice.
We have a mixed billing approach. So children 16 years and younger are bulk billed. Pensioners who are over 75 are bulk billed. There are some grey areas where some people may be on unemployment benefits, and we will probably bulk bill them. There are some disability support pensioners who are not, they're sort of between age pension and working. We will almost certainly bulk bill them. But generally, if you don't have one of those cards, then you're expected to pay.
Okay. And what are your payments at this moment?
That's a good question. I think it's around about $35 to $40. It just depends. It is entirely at the doctor's discretion what is charged. I charge my fees. My colleagues choose how they choose to charge their fees.
So true independent practitioners.
Exactly. We cannot say you will charge this amount. We would have a discussion and say, well, as a general practice arrangement, this is what we do. But if you choose to charge everybody, that's fine.
Fair enough. That's really good to know. Is it sort of an area of growth in Sale at the moment? Like you said, there's lots of schools in the area. Is that because there's lots of families moving to the area?
Not as many as we'd like. But yes, if I watch with some sadness farmland being cut up for housing, I guess there is some expansion.
Yes, okay. So new patients, do you have many new patients in your joining your clinic?
Yes, I have a very simple philosophy about new patients. It goes like this. Some patients die. Some patients move away. Some patients decide they don't want to see you anymore. So there are always going to be vacancies. Unlike the National Health Service, you're not tied to a particular doctor.
That's right. Absolutely. Very different, isn't it? Very different. So we've talked about the hospital, and then there's a hospital. Is that far from your clinic if there was support needed?
It's in the town.
Okay, lovely.
2 minutes away.
Excellent. And in regards to allied health, do you have any on-site or nearby?
We have a alcohol and other drugs nurse practitioner who comes once a week. We have a diabetes educator nurse practitioner who comes every other week. We have a nurse practitioner who we employ in one of our branch surgeries, and she comes to the main surgery once a week and does ladies' things like insertion of intrauterine contraceptive devices and that.
Yep, excellent. And are you a training facility? Do you have registrars and medical students at your clinic?
Yes, absolutely. Have been for forever.
Yeah, it's great. It's important, isn't it? We do it at our clinics as well.
It's very important.
Yeah, absolutely. Future. It's the future. So you have supervising GPs at your practice as well then?
I'm a supervisor. My other colleague is a supervisor. And we have 3 fellow GPs who are going through the process of becoming recognised as supervisors.
That's really important. I think supporting the next generation of GPs is something we should all be striving to do. So that's great to hear.
Well, I believe it's our responsibility to teach the next generation.
Absolutely. Support them as best.
We have medical students who are embedded in the practice as well.
Excellent. Are they there full time with you or they do a couple of days a week?
They do 3 days a week, Monday through Wednesday, and then their Thursdays and Fridays they go off and do other things because the medical school has an attachment to the hospital.
Right. Yes, that would make sense. So lots of GPs ask us what a typical day would be for a GP in your practice. Perhaps you could talk us through what a typical day for you would be.
I don't know. I come in and I look at the waiting list and think, it's time to go home. People coming in for prescriptions, people coming in, you have mystery patients. You're never quite sure what they're coming in for. You may have a skin procedure booked. There will be a number of patients, not really patients, but people coming in for medical examinations, fitness for employment, and that kind of thing. What have I seen this morning? I've seen a man with prostate cancer, a man with Parkinson's disease, a man with mild hypertension, another fellow with epilepsy, a man with some anxiety problems, a veteran with came in for a general discussion, a chap who's having some issues at work and needing some advice. A lady came in who's got severe pulmonary disease, and we had a discussion about that.
So are you seeing 15-minute consults?
Yes.
Standard consult would be 15 minutes, yeah.
Some consults will be quicker than others, but that's the nature of general practice.
Sure is, yeah. And you accept walk-ins at your clinic?
I like to think we're flexible enough that if somebody comes in and you think it's going to be a routine consult, and then they say, and I'd like to talk to you about.
They'd open the list.
You've got time whilst they unload about some problem that's the first time you've heard of it. Yes,
of course. So what time do you start typically? What time does your session start each morning?
Well, because I'm the senior member of the family, I generally start at 9:30, sometimes 9 o'clock. My other colleagues will start at or before 9 o'clock.
And you stop for lunch together?
Sometimes, but we aim to make sure everyone gets a bit of a lunch break. We aim to finish at 5 o'clock, and try and get everyone out of the place, so that we're
in good time to enjoy an evening. And that's what a lot of our doctors, particularly from the UK, are looking for, is a real work-life balance. They spend a lot of time commuting to work. They spend a lot of time in the NHS now seeing so many patients during the day, and then spend, many hours of an evening trying to catch up on paperwork. And they really want to get that balance right now. And I think it's fair to say that's not something that would be expected in your practice.
Look, I've got a couple of reports I've got to do, and I will knock them out in the next 24 hours. That's the way I choose to work. I do house calls, and sometimes I will do house calls after I've finished in the clinic, because that suits me. And I also do nursing home visits as well.
Excellent. So a GP joining your practice would have the autonomy to have their day set out as they choose.
Absolutely.
Yeah, excellent. And what does your ideal candidate look like? Who would be a really good fit for your practice right now? Don't say anyone with a pulse.
I mean, the sort of doctor I would be looking for is someone who wants to come to the country, who is prepared to become part of the community. I'm a great believer in being part of the community. I am involved in my local church. I am involved with the Agricultural Society, and I belong to other entirely non-medical organizations as well. We have a car club. I've got an old truck I'm having my old age crisis over, not a midlife crisis. And so, you know, I believe that if you're as a GP, if you're working in the community, you should make yourself part of that community, because it gives you a better feel, and I think the patients respect you for being part of the community. I'm a veteran, so I'm involved with the veterans, and I do quite a lot of work with them. So my ideal candidate would be someone who is prepared to move to the country, live in the country, and you know, join the local football club, join the local netball club, cricket. There's a whole raft of as you know, we in Victoria play a slightly different form of football to the rest of the world. But we do have the round ball for people who wanted to play that sort of game. They're very welcome. So, you know, there's an enormous number of sporting things that a doctor can join or become involved with. We have St. John Ambulance, which I'm very enthusiastic about. So that, you know, that's the sort of person I want. Obviously, I would like to think that they're properly qualified, that they're got their MRCGP or FRCGP or
something. Health Recruitment Australia will ensure is the case. What about things like special interests? Have you got do you feel your team would benefit from a female GP at the moment, or somebody who has an interest in skin cancers, for example?
Yes. We're actually quite well off for female GPs at the moment. An enthusiastic young male GP would go well.
Special interest?
Well, I used to do quite a lot of work with the police. They're always, you know, there's scope for, you know, if someone wants to do some forensic medical officer work, they're always looking for people to do that. There are industrial medicine, obviously someone with an interest in occupational medicine, very much so.
Okay, that sounds great. That sounds really good. You're open to full-time or part-time? You're not too concerned about what hours they're choosing to work?
It's entirely up to the doctor.
Lovely. Excellent.
I want someone who's prepared to work 7 days a week.
Wouldn't that be marvellous? 24 hours a day.
2 weeks annual leave every other year.
I know. Wouldn't that be joyous, you know? What would Sale Medical Centre be offering in return for a GP to come and work with you? What do you have on offer for GPs?
We would guarantee a starting salary, but an average salary would probably be around $300 $100,000 a year. It depends on how you work. If you only work 2 or 3 days a week, well, your salary will be reflected in that. If you work 5 days, it will be reflected.
Absolutely. Yeah. Anything about some sort of relocation allowance? Is that on the table?
We haven't discussed that, but that would be open to negotiation.
And I believe your company is set to be sponsors for visas as well, so you'd be able to sponsor the UK GPs.
Oh yes, we're well used to that.
Excellent. One thing we didn't touch on earlier when we were discussing the practice was the support staff that you have there. So you have reception staff with you as well, and
yes, we have an excellent reception team. They're very tight, and they're very protective of their doctors, but they, and because they live here, they know a lot of the patients, so there's it's a friendly place to come.
Of course, and then led by an experienced practice manager, I assume. Yes, excellent. And registered nurses on site as well for support for doctors.
We have a very good team of registered nurses.
Excellent. That's great. Now, I know I've been liaising primarily with Jonathan in regards to candidates that Health Recruitment Australia have been sending your way. So you may not be able to answer this next question, but have you sort of felt the benefits of working with Health Recruitment Australia in your GP recruitment?
Well, the benefit I see is that we're seeing some quite good quality candidates. Particularly the last one you sent us was very good. That's
right. Yes, absolutely. And I think the benefits of working with a recruitment company have been quite evident to lots of our clients of late in the reach that we've been able to get, and as you said, a good quality candidates. So hopefully we can keep those coming through to you, Iain, as well for your review. Yeah, excellent. Now, is there anything else you wanted to touch on while we're talking? Anything else you want to share with the listeners about the clinic, the area, what you have to offer?
I would say that it's a good clinic. I like it. I enjoy general practice. I don't feel burnt out, not very often. There are times when you feel a bit worn out, but that's slightly different. I think the pace is good, and we operate a cheerful company, and I think we're very welcoming.
Yes, it sounds like it, and it just sounds genuinely like a really lovely place to be as well. Sales sounds like it's got a lot to offer to people looking to move into the country. So that's really lovely.
One of the good things about Sale is it's on the railway line, and we have a regular train service to Melbourne. If you drive to Melbourne, it's about 2.5 hours, depending on the traffic. We are about 3/4 of an hour from the surf beach, and about 2.5 hours to the snow.
Wow. Sounds perfect. It's like such a perfect location.
Well, the Shire call us the middle of everywhere.
Is that right? And that would be logical.
Yes.
That's lovely. That really is lovely. Yeah.
So I recommend anyone sort of thinking about it to go onto the Wellington Shire website, because that gives a very good overview of the area.
Right. Oh, that sounds fantastic. Well, I really appreciate you taking the time to meet me today, Iain. I've genuinely enjoyed hearing all about Sale and the clinic. It really does sound like a wonderful place to be.
It is.
Yeah, absolutely. Your community are very lucky to have you, and we'll continue to send some great quality candidates your way. So thanks so much for joining me.
Thank you very much.
That's all for this week's episode in our Clinic Leaders series. I'll see you all again next time. Bye for now.
Bye.
Thank you for listening to Living the Dream for General Practitioners. Don't forget to subscribe on your favourite podcast player so you don't miss an episode. At Health Recruitment Australia, we want to see more happy GPs, thriving medical practices and healthy communities. If you'd like to join us on our mission, visit healthrecruitmentaustralia.com.au to explore opportunities and to get in touch. Thanks for listening.